everyday fight. It is not going to stop. One day I woke up, I went for a walk, and then I'm healthy. It doesn't go like that. Bazakhot, if you do such stuff, one day suddenly, sir is getting excited. I want to go to a gym. Recently, just yesterday's case, one boy, he thought that somebody told him, "Motu hai tu, mota hai, aisa kaisa hai." He got upset, and then he went with his friends to the gym. And that night, he did a very very heavy workout. Dumbbells, bench press, chest press, ye sab kuch, everything he did. 2 hours workout he has done. And next day morning, his urine is red in color. Young boy, 18-year-old, peer pressure. All of a sudden, you cannot become Salman Khan or Hrithik Roshan. Peer pressure, all of a sudden. And then red color urine came, they came to me. Then we found out that his muscles are breaking. This is a disease called rhabdomyolysis. Anything if you do more, muscle cells break. And then that pigment gets stuck in the kidney. Then he had a kidney problem. Anyway, he's getting treated. So anything if you do more than normal can be dangerous. If you do less than normal also can be dangerous. So in life there is something called normal. If it's too cold, not good for us. If it's too hot, it's not good for us. So similarly, health is the real wealth, and there is no more or less in this. The more the better regarding health. And to maintain health, especially kidneys health, there are 8 golden rules. In our body, there are 5 vital organs. First one, the brain. We'll go from top to bottom. Brain. If there is no brain, there is no life. Second, heart. If there is no heart, there is no life. Third, lungs. If there is no lungs, there is no life. Fourth, liver. If there is no liver, there is no life. Fifth, kidneys. If there is no kidneys, there used to be no life. Fortunately, today we have something called dialysis, which people can survive on. It wasn't there before, but still it is a vital organ. So if you get admitted in an ICU, or any of your relative is there in an ICU, if the question comes, bachte ya nahi bachte, will he make it or not? It depends on these vital organs. Each organ is given 20 points. 20 to the brain, 20 to the heart, 20 to lungs, 20 to liver, 20 to kidney. All 5 are working good. We are 100% normal. If the ICU doctor tells there is a problem in his heart, lungs are not working, oxygen is down, liver enzymes are high, there is something wrong in the kidney, then 80% chance of him to go. And if that person becomes drowsy, then be sure that only a miracle can save. These are vital organs. So one of the very important organ is kidneys. And kidney health is the least, people think about it the least. The least importance given to all these organs is the kidneys. Why? We can't see it. This is one point. Second, the symptoms come very, very late. After 80% of the kidney gets damaged, then only you get to know that I have a kidney problem. Then only the symptoms comes. And by the time we find out you have a kidney problem, you need some treatments, too late. Nothing can be done. Dialysis machine is waiting. That's all that happens. So kidney health has to be preserved. It has to be prevented. We can't diagnose and treat it. By the time we diagnose, too late. So it has to be always prevented. Unlike a heart, you get a chest pain, immediately go to a cardiologist, they put a stent inside. Unlike a brain, you get a paralysis attack, immediately you get some treatment. But kidney disease is very, very subtle, very slow, very slow. And the functions of the kidney is one of the most important function is it regulates the quality of your blood. In simple language, it regulates the quality of your blood. It keeps your blood pure so that all these organs can run. So if your kidney gets damaged, your blood becomes impure. Something goes up called creatinine, urea, and these impurities will start manifesting by affecting your brain, your heart, your lungs, your liver, your skin, your sleep. Everything gets affected. Hair quality, everything is affected. And then people go to so many doctors. By the time they get to know they have a kidney problem. So kidney awareness is very, very important. Recently there was a patient, again, personal stories, because we see day in, day out. There is significant swelling in his abdomen. Water is there. It is called ascites. Abdomen distended. He goes to where will you go? Abdomen specialist. He went to a gastroenterologist. He did an endoscopy. colonoscopy, ultrasound scan, and he found out that there is nothing wrong in my side. He told you go to a cardiologist, there's something wrong in your heart. That fellow did an angiogram, and then he found out his heart is also okay. Then he told there is something wrong, you go to a physician. That fellow, he did a lot of better investigations, he found nothing is wrong. And then one simple urine test, which cost 100 rupees, that showed some protein leakage in the urine. And that was a kidney problem. He needed a kidney biopsy, that is a nephrotic syndrome, and he got cured. So just to find out that you have a kidney problem, the medical awareness in doctors is so less. Kidney problem to baad mein dekhte hain. Kidney problem has no treatment. It's not like that. Kidney problem has treatment if diagnosed on time. And kidney manifests in a huge variety. So it's important to prevent it. We can't keep checking it. Once a year is enough. We can't keep on checking how the kidneys are. So the first golden rule is to find out how is your kidney working. So it consists of 3 investigations. Everyone should do it probably on the New Year night, 31st, or your anniversary, or your birthday. Some date which you have to remember. So just to find out, like you pay your insurance EMI, whether next year is okay or not, like you take your children's report card. These 3 investigations are kidney report card. First is simple blood test called serum creatinine. By finding out the quality of your blood, how much poison is there, what is the toxin level. The normal is 1. And if that creatinine goes to 1.5, that means the kidney function has come down by 50%. It's such a dramatic number in the beginning. But if that creatinine goes up to 5, 6, 7, 8, it's not much difference. Still the GFR is very low. So creatinine is very important. We have to check it once a year. Mandatory. Second, simple investigation is urine test. So this is the kidney function, creatinine, by which we can calculate the GFR. Second test is urine. Kidney is a filter after all. How is the filter working? By checking the urine we can find out. So urine gives a lot of information. How much protein is going, how much blood is going, how much pus cells are going, any crystals are going or not. The urine has to be normal. Third, whether we have 2 kidneys or 1, whether the kidney size has become small, whether the kidneys are swollen, whether there is a stone, whether there is a prostate, we don't know. Unless we do a scan, we never find out. So it's important to do one ultrasound scan to look at the kidneys. So these 3 investigations comprise the report card of kidneys. First, kidney function, serum creatinine. Second, kidney filter, urine test. Third, kidney structure, ultrasound scan of the abdomen. This is the first golden rule. We have to start from checking. Unless we check, nahi check kare to kuch to nikalta hai. Hai to niklega. Otherwise, there is no point. So, second is drinking a lot of water. Probably this is the first actually for anybody. But since we are bankers, educated, we should start checking first. So drinking a lot of water is important. How much water to drink? We should drink that much water that our urine is white in color. If it is getting yellowish, darker yellow, concentrated orangish, then reddish, that means you are going into dehydration. Your kidney needs water. If it doesn't get enough water, then the kidney will become weak. And then kidney stones start forming. Kidney function decreases. In the long run, kidney can get damaged. So drinking water can depend from temperature also. Sitting in a bank, it's very cold here. Someone standing there, it's very hot for him. In the male, female, there's a difference. Children, adult, there's a difference. So most important is looking at the urine color. If your color is white in color, you are well hydrated. Or probably it's always good to be slightly overhydrated. So urine white in color is important. Any water we can drink. Cold, hot, doesn't make a difference. But we should drink water. We should stay hydrated. After that, diet. A diet which is very high in protein can be dangerous for the kidneys. Kidney has very delicate filters. And as I have told you, somebody was leaking protein in the urine. If protein comes in the urine, then the kidney filters start getting damaged. So taking a low protein diet, inherently South Indian diet is a natural low protein diet. It's around 0.6 to 0.0 grams of kg body weight. So our diet is very nice. We should continue the same thing, but reduce the salt in that. High salt diet causes hypertension and eventually can cause kidney damage, especially achar, papa, these are all dangerous stuffs. We have to quit this or reduce it at least. After that comes exercise. We should at least walk 30 minutes per day. No, my office is in the 4th floor, sir. I climb 2 times up. That's not exercise. That's your necessity. Exercises, you should take specific time out for that and walk at such a pace for at least 15-20 minutes that you're not able to speak one sentence in one breath. That is workout. It's just going around from here till Panjaguta. It's a time pass. So that will not yield you any results. 10,000 steps in the mobile phone will not yield any results. You have to walk that with that intention and with that pace. That gives results. Exercise. Quitting addictions is important. Addictions can be very, very dangerous, especially smoking, tobacco, and then gutka, lot of alcohol. This all can eventually lead to kidney damage. And the greatest addiction is soft drinks, energy drinks. Lot of pressure, boss. I need Red Bull. Gives you wings to the dialysis unit straight. So such things can happen. We should be very, very careful. That's the biggest addiction. Carbohydrate addiction. Soft drinks. Instant pleasure. Instant kick. Kicking to the graveyard. So such things happen. Be very, very careful with soft drinks. After that comes avoiding use of painkillers. Working 6 to 8 hours may be okay. Suddenly that person gets some pressure. He's working for 16-18 hours. And that fellow gets tired. And then they start taking painkillers. That is also a big, big crime. If you are working more, if somebody is going to the gym, he's getting body pains. So the aim is that pain is natural. No, nobody takes painkillers for that pain. But trust me, many laborers, they work out in the field, construction site from the morning to evening. In the night, they have to take a Combiflam tablet and sleep. One Boveron tablet to sleep. That these all painkillers are dangerous. They cause kidney damage, especially among the females, ladies. Mummy wakes up first in the morning, gets things ready, makes breakfast, sends children to school, then husband's turn. After that, doing the household job, children come back, then again husband's turn, then somebody in the evening makes children sleep, makes husband sleeps last. She gets tired. And that tiredness has to go only with the help of sleep. No time to sleep. So that painkiller habit starts. And after 3-4 years, kidney starts getting damaged. And there is no return from that point. So painkillers has to be avoided. These painkillers are very cheap, sold over the counter, but they have to be stopped. We should never use painkillers. And the number one killer for kidneys in the world is diabetes. Uncontrolled sugars. Whether we have it or not, we should check. Unless we check, we never know whether we have. Diabetes is also a silent killer. Diabetes is the number one cause for kidney failure, number one cause for preventable blindness also. Many people have become blind because of diabetes. Many people have lost their leg because of diabetes. So diabetes is a crippling disease. Now my sugar is 400, nothing happens. Nothing is happening today. But tomorrow something will happen. Something dangerous can happen. We should be very careful. We should start checking sugar. We should check blood pressure. Hypertension, world's number 2 reason because of which kidneys fail. It has to be checked and treated. So these are 8 golden rules. Just to summarize. First, lot of water, diet low in protein, exercise 30 minutes, quitting addictions, avoiding painkiller use, controlling blood pressure, controlling blood sugar, and checking the kidney once a year. And if you are at risk, check it twice a year. At risk means somebody obese, somebody with family history of kidney disease, somebody who has diabetes, somebody who has hypertension. These are risk factors. If somebody has risk, that should be done. So SAP Kidney Center, this is our hospital which works on the foundation pillar of we prevent, we care, and we pray. And SAP Kidney Center also hopes to do free kidney transplant. And we have our own charitable trust. We have done one last month. We have our own charitable trust called Umeed Charitable Trust. So, because we don't believe in dialysis. Dialysis is not a treatment. Dialysis is maintenance. It's something like it's summer, you switch on the AC. The moment you off, you're back to the normal. So dialysis just gives you life for a day or two. So we are working on a model where money can be utilized in the right way. And dialysis is not the treatment. Transplantation in the present scenario is the treatment. Probably in the future we may have stem cell created kidneys or lab created kidneys, whatever we call it. Something may come in the future. But right now, transplant is the standard of care. And people can't afford it, 8 to 10 lakhs. So we have established a trust called Umeed Charitable Trust, and in which people donate money, in which we also donate money. And we have done one end-to-end free transplant. And hopefully we'll do more. So once I was reading about this, I went through one incredible doctor's history. His name is Sam Shetty from Bangalore. And he established a bank like that. That's called Vijaya Bank. So that got closed anyway. Government acquired that. So the story was patients didn't have money when they needed it the most. So that fellow used to work in a small village. So what he did was, आज पैसे नहीं है vaccine के कोई बात नहीं. Every week you give me one paisa like that. This is like before independence, way back in the 1920s, 30s. As I vaguely remember, I don't know, I have to recheck the net, but so he used to collect two paisa, one paisa in the 1920s from the villagers. And whenever they used to fall sick, hardly they used to fall sick probably those days. He used to give them injections. So much money he accumulated, he had to establish a cooperative bank. It's called Vijaya Bank. That was acquired by the government in the 1960s probably. So presently Umeed Charitable Trust also is getting a lot of money, but we hope to associate with bigger partners where we can do some charitable work and cure kidney disease by preventing it. Because kidney disease, the only cure is prevention. And if it happens, then transplant is the cure probably. There is nothing in between that. CKD has no treatment. CKD has either prevention or replacing the kidney. So we have to cover both of the things. Yeah. Thank you.